Hello, you are tuning into Media Soundwave. My name is Heather Cassidy and today we are joined by Liz Ashall-Payne, the CEO of Orcha.co.uk. Hello Liz.
Hi.
Thank you for joining us.
Thank you for having me.
Today we are going to talk about how apps are transforming healthcare with over 2.5 billion users of smartphones globally, and 6 out of 10 people have actually looked on their phone questions about healthcare, something about their health and health related. So with these apps at our fingertips, they are really making a difference. Can you tell me about how you ended up getting involved with Orcha and what difference it is making?
Absolutely. My background is I'm a speech and language therapist.
Okay.
I developed my specialism in complex paediatric care, and very early on in my career got really frustrated with the fact that I could only support the one patient sat in front of me.
And you wanted to get out there and help more people.
Absolutely. And so what I started doing was looking at ways in which we could improve and be more efficient in the way that we deliver service. But actually there's only so far you can go with that, and at some point you've got to look to innovation. And around about 5 or 6 years ago, there was this huge explosion of healthcare apps in the marketplace. So at that time there was around 30,000, and now what we see is around 325,000 health and care apps.
Wow. That is such an alarming number. It's huge.
And it's growing all the time. So just before Christmas there was around about 305,000. Now that's increased by another 20,000. So this marketplace is hugely expansive. And the frustrating thing about it is that people are downloading these products, which is great, but they're not necessarily downloading the best app for them, or
I've done
the
that myself,
safest.
not necessarily with health apps, but I've downloaded apps in the past and gone onto it and thought, actually, we don't do what I thought you would do.
Exactly. And then what happens is, if you're a confident user, you might go back and try another product.
Find another
but
better
if you're
product.
not, you might become cynical and think, well, I won't bother, and we've missed an opportunity then to have an impact on somebody's health. The other interesting thing is, as a healthcare professional, and when you ask other healthcare professionals think that apps could help their patients, over 90%, but they don't know. It's huge, but they don't know which ones they can trust, or which ones are safe, or which ones are high quality. So do you work with doctors then to tell them which apps to prescribe to their patients? So what we do is we start with a review of a product, and we review health apps for data, clinical validity and user experience, and that culminates into a review score. Now, a review score is always out of 100, but we also tell you what the side effects are of the product.
Okay.
So the side effects might be that it doesn't work for somebody who's got a visual impairment.
So are things added then for people with hearing and visual impairments?
In some cases, yes, but not in all of them.
But you score the app on whether they do cater for people.
And we allow you to search for products and filter according to personal preference and need. So it means that, say for example, if you're diabetic and you want to search for an app to help you with your type 1 diabetes, to help you monitor your blood sugars, you can now type in diabetes and you might get 3,000 products back, which is what the marketplace is, but then you can filter according to what you want from that product in the same way that you do when you book a holiday.
And you can see what suits you and whether you're an Android user or an iOS user, and things like that.
What age you are, what product, what functions and features you might want from the product.
What you need from the product.
Exactly.
I suppose it's like with anything, isn't it? Everybody has a different need for something. Actually, you mentioned diabetes. I was reading about diabetes, and that there's an app, I don't know whether it's one that you work with, but there's an app where you can put in all your information about what you eat and everything like that, and it looks at all the algorithms, and it can actually administer what you need to correct your blood sugar levels. Is there anything like that on your site?
So there is basically an app for everything.
App for everything.
Absolutely everything and more than you could possibly think of. And the point of what you've just described there is, if you've got diabetes, what you need at point of being told you've got diabetes versus if you've had diabetes for 10 years is very different, and your needs change over time. So yes, there are apps that do that, but if you've just been told you're diabetic, the thing that you need is information.
Information and how you can monitor it, and maybe things that you can do to change your diet and things like that.
Yeah.
Which is really a big point of it. But so I mentioned that then. Is there any apps you can think of specifically that have got really great tech uses that you wouldn't have even thought of? Because it's mind-blowing, isn't it? There's so many things that they can now do with apps that I wouldn't have even thought of until I actually looked into it.
Absolutely. And what we see from what you just described is you've got a medical device.
A medical device, yeah.
Attached to an app. So most things now do have an app attached to it.
So how I just mentioned the app that involved the medical accessory and it can help with diabetes,
Yeah.
is there other apps that you can think of that attach accessories? Any that you can think of?
Absolutely. So if we take, let's say for example, asthma or COPD or any breathing challenges, there are apps that are attached to breathing
Wow.
breathing devices. There are apps that are attached to sensors in your home that can monitor where you are.
How does that work?
So it's really interesting. So if you think of a case of a parent or a loved one at home and they want to live independently, but they might have dementia.
Okay.
And as their carer, you want to make sure that your loved one, your family member, is up and about and moving around.
Yeah.
Well, there are products on the market that can tell you, the carer.
So would that be sensors more than just cameras in the home?
Absolutely, and most of us have sensors in our home because we have alarm
Burglar
systems.
alarms.
Exactly. So it's about using the infrastructure that we already have, and that app
Someone's
does
cat or
that.
dog not set those sensors off though to trigger it?
Well, so in some instances, yes, but what you're looking at is trends in that instance, so trends of data. So
and the times people are getting up and where the movement is.
Absolutely. There's another example which is really simple. It's a plug that it gives you 3 rings every time your mum or dad or loved one turns the kettle on, so you know that they're
And
doing
that's definitely not the
something.
dog.
No, exactly.
I hope not anyway.
Yeah,
He might burn himself.
Yeah.
So I was reading about one that you get a metal device or something and you attach it to the back of your phone
Yes.
and you can monitor your heart rate.
So that's the Alive Core. So the
Wow,
Alive
that's-
Core is
That's fascinating.
it's quite funky looking, so it doesn't look like a medical device, but you attach it to the back of your phone and you can take your own ECG. And what's great about that is, I don't know if you've ever experienced needing to have an ECG where somebody puts the monitor
Yeah,
on
I've
you.
had an ECG.
And quite often you don't experience the heart palpitation or the problem when you've got the ECG on, which is really frustrating. Whereas if you've got the product with you, as soon as it happens, you can take your ECG and then you can take the data back to the
Where
doctor.
is that data going? So is that then for you to store to take to the doctor to show them what's been happening? Or if it spikes to a certain point, can it then trigger somebody?
So different apps do different things. In the
Okay.
Alive Core case, my understanding, unless it's changed, is that it keeps it within the phone and you take that data to your doctor and they can look at the data in your
But there
phone.
might be a different app that will alert emergency
Absolutely.
services if you are going
Some
to have a
apps-
heart attack and things like that.
So some apps are able to share data. Obviously, you need to consent to have had that data shared with the
Completely.
NHS and vice versa. So different apps do different things because they're all for
But it's
different
fascinating,
purposes.
isn't it? The different things that can be done with an app when we're all carrying these things around in our hands.
Absolutely. Absolutely.
There's more to than just Google something.
Yeah.
Have I got a headache? What can I do about it? You can actually use these things to monitor it.
Absolutely.
It's brilliant. So I know you're going to schools, don't you, and do some work with schools.
Yes,
Can you give me
we
some
do.
examples of the work you've been doing?
So one of the things that we wanted to look at is basically we wanted to use our greatest asset in the community, which is our children.
Completely.
So and traditionally children have been taught about health within an education environment, and then they go home and use the power of pester to
They come and remind us about what they've been doing in assembly.
They do. So don't smoke, don't drink too much alcohol, all the good public health
My daughter
messages that
chases
they're getting.
everybody around to make sure they don't smoke. She'll even shout at builders she doesn't know who come to the door. She'll be like, they're smoking.
That's exactly right. Exactly right.
She
So we
shouts
want
at
to
everybody.
use that power, and it's really powerful. So what we've created is a curriculum-based product where teachers talk to children about their health, show them the range of healthcare apps, and invite them to start using a portal which is purpose fit for children and recommend apps to their family members and friends, and also obviously download apps and use them
Are these
themselves.
apps then that they're then recommending at home to their parents, or are these child-specific apps that they can use?
Both.
Both.
So in the instance of your daughter, if she could recommend a smoking cessation app to
She
her
would to
builder
every-
friend, then off she
to
can go.
everybody she could go.
And she can send it direct to their phone.
She'd get it out inside supermarkets and go around showing people they're in Darcy. She'd get everybody told. So in terms of that, so you're going into schools and that's part of a community outreach. Is there any other things that you're doing with regards to community outreach, working with councils or businesses?
Absolutely. So one of the main things that we do is we create localised targeted app libraries
Okay.
at region level. So say for example we're sat in Manchester at the moment, the whole of Greater Manchester can have its own health app library targeting a specific population. And then what we do is we work with the doctors, nurses, health and care professionals, and they become the prescribers of health apps, so that you go and see your doctor, you say, as happens to us all, I'm experiencing some anxiety, I'm going through a challenging time in my life. At the minute the doctor's only able to prescribe drugs or ask you to go and monitor. Now he or she can prescribe you an app.
Apps instead.
Exactly.
That's great, because sometimes it is just changing the way we think about things, looking for new information, or even just finding the information to start with, because a lot of the time it's just because people don't know the information is out there.
Exactly, and in mental health particularly, there's 12,000 health apps.
I was going to ask you, is there any apps to help mental health? What kind of apps are out there?
So there's 12,000 for mental health, but that breaks down into a whole range
into all
of
the different categories. So does that go into then anxiety and anger and depression, stress?
Post-traumatic stress disorder, even things like suicide prevention. There are apps for psychosis, some really quite challenging mental health areas. So it's not just your staying healthy and well from a mental health perspective, but there are apps that can really support you if you have a mental health condition as well.
It's great with anything though, if you can keep track of whatever your health condition is or whatever your thoughts are on something, if you can log them down and keep it all the data there, it helps, doesn't it? It helps you and your care providers as well.
Absolutely, and a lot of the apps don't just help you to monitor and manage conditions, they also help you to offer you a service that sits behind it. So a lot of them have health coaching tied in, or telecare, telehealth, where you can have a conversation with somebody through your phone.
That's fantastic, because then there's somebody else on the other side of it, isn't it?
Especially
with suicide prevention and things like that.
Absolutely.
So in terms of working with GPs, how do you think it's actually going to change the relationship between GPs and patients going forward, that people are using these health apps?
So I think what's happening more and more is, as patients, we're turning up at the GP practice with our phone and saying, I've been using this app. And actually that's a bit scary for clinicians and GPs, because we might not necessarily know whether we can trust that product. So the first thing is they use our site to be able to find and enable them to...
Ones that they know are trusted and have got the right information on there.
That's exactly right. And then the second thing is they can then be empowered to say, that's great, but there's an even better...
Have you tried this?
Exactly. And then the whole prescribing of health apps means that you're not only walking away with a drug, but potentially a service. And apps aren't just about monitoring and managing, they are services in their own
provider in their own right.
Exactly. And if you think about, unfortunately, we do have waiting lists for healthcare provision. If you're able to be given a service immediately to your phone, which you carry with you everywhere. So you can start
doing something about it today whilst you are
exactly.
waiting.
And then obviously the next stage is being able to share that data back with your healthcare professional, so that they can make a more informed care pathway plan with you.
I think it's important as well that we have actually got control of some of our own medical records.
Absolutely.
And our own data, because at the moment when data is only elsewhere, we haven't got access to that. It's no good to us, because then if we see a different care provider, it's a continuation of services, isn't
Absolutely.
it, to get the best support.
So that's a massive strategic focus for NHS England. They want you to have your patient held record, and they're very aware that you've got all this other health data that's being brought in by a smartwatch or by an app on your phone, and that is your real health data. What the NHS holds is your ill health data.
So in terms of these apps that GPs are recommending, I know that you work closely with the apps directly to make sure that they're providing the best standard and continually updating. What kind of things do you do with the companies to make sure their apps are the best that they can be?
So once an app's been reviewed, we contact the developer, or a developer can contact us and get their app reviewed. And what we do is we provide them with a full improvement report that tells them very practically what to do to meet standards, regulation and best practice. We always put apps on the marketplaces, excuse me, or the app libraries in rank order of the highest app, the best app backwards.
So is that generally how many people are using it, or is it actually what are they actually ticking off to provide services to people?
So really good question. There's about 2,500 standards, regulation and best practice that could need to be applied to an app. We apply the relevant standards, regulation and best practice, and we turn that into an improvement plan for the developer so that they can make sure that their app is best fit for healthcare.
Perfect. So who's on your team at Orcha?
Okay, quite a big team.
I was going to say, I know you're quite a big team. You've got health professionals within that team, haven't you?
We do. We have medics, and we also have healthcare professionals, but we also have data safety and security experts.
Which is important when people's data is getting passed around.
Absolutely. We have academic leaders. We also have a health economist in the team. We have a lawyer in the team. We use a lot of patient representatives. So we have a review team of experts who are experts in very, very small niche areas, and together they make sure that our
and they have the
processes.
expertise in those different areas.
That's exactly right.
So obviously it's available here in the UK. Where else globally is it available?
So orcha.co.uk is open for anybody to be able to access.
Okay.
But we work predominantly in the UK, because we are a UK based organisation. However, we are starting to stretch further and wider into Europe, and a lot of our standards excuse me, a lot of our standards are European wide. So for example, everybody's talking about GDPR.
GDPR to protect everybody.
Absolutely, and that's a standard that we will make sure people are ready for as an app developer, to make sure that the healthcare sector can use them.
Fantastic. So what is the future for Orcha then?
So I think for us, what we want to be is the place that you go to when you think of health. If you want to stay healthy and well, or you want to manage a condition, the first thing you do is you go to our app library and find yourself the best
Type
product.
in your condition and find out the reviews on there of the different apps. Thank you for joining us today, Liz, and telling us all about all the fantastic things going on in apps and healthcare. Thank you to everybody involved in today's show. Thank you for tuning in. We'll see you next time here again on Media Soundwave.